Good morning, everyone. I'm delighted to moderate this kickoff leadership discussion on health, AI, and the productivity imperative. The Council on Competitiveness Conversations Across America series is really honored to be here in Pittsburgh as we bring together high-level, multi-stakeholder leaders at the local, state, and regional levels under the auspices of our National Commission on Innovation and Competitiveness Frontiers to provide a national and regional platform for dialogue and action. This is the 8th such conversation that we are hosting across the United States. And also, we are very honored that this National Competitiveness Conversation is held in conjunction with the 2025 annual meeting of the Global Federation of Competitiveness Council. So I want to welcome everyone from around the world and, of course, in Pittsburgh who are with us today. This, of course, is a tremendous topic that we're going to address when you think about the progress in health and what it's meant to human society. In 1900, global life expectancy was about 31 years. Today, it exceeds 70 years. The power of science and research, bringing forward pharmaceuticals, vaccines, medical devices, new practices, stronger health systems, made this possible profound transformation in human potential. Yet, costs have also risen. Today, healthcare represents more than 10% of the world's GDP. In the United States and across many nations, rising costs have become an economic, a social, and a huge competitiveness challenge. The Council on Competitiveness and Gallup Corporation identified healthcare, housing, and education as one of the 3 verticals that was holding back U.S. productivity growth and greatly contributing to a structural potential decline in the nation's competitiveness. Yet, of course, we are seeing the breakthroughs at warp speed and scale, from deciphering the human genome, coupled to proteomics, synthetic biology, gene editing, the fusion of biology with AI and supercomputing. We are entering a new era, a future bioeconomy writ large, and AI is the critical enabler, catalyst, and driver. So this morning, our extraordinary group of leaders are going to address and discuss how can we harness health innovation, not as a cost, but as a driver of value creation, productivity, competitiveness, and shared prosperity around the world. We have an extraordinary group of leaders with us today. Let me introduce Chancellor Joan Gable, who you know, of course, Chancellor of the University of Pittsburgh, Vice Chair of the Council on Competitiveness, and a member of the GFCC, President Farnan Jahanian, President of Carnegie Mellon, and a member of the Executive Committee of the Council, Chad Holliday, Chair of the GFCC, Chair Emeritus of the U.S. Council, former Chair of Royal Dutch Shell, Bank of America, DuPont, and other corporations. Dr. Jeff Gold, the President of the University of Nebraska, a member of the Council's Executive Committee. Admiral Ted Carter, the President of Ohio State University, also a member of the Council's Executive Committee. And Dr. Harris Pacides, President Emeritus of the University of South Carolina and Distinguished Fellow of the Council on Competitiveness. So Harris, I'm going to start with you to really, as a distinguished epidemiologist, to really start the discussion on why is our discussion about AI in the context of health so important for U.S. competitiveness.
Well, thank you, Deborah, and good morning, everyone. We're all unique on this panel. My core value is public health, lifelong public health researcher and teacher. I lament the COVID epidemic, as we all do. I think we could have done much better, and could have done much better, by the way, with the help of what I call augmented intelligence. I don't choose the word artificial. I think it frightens people. It connotes something that might be from outer space. There's not one thing that's artificial about AI. We invented it. We came up with it. Of course, people are fearful about it, and when you deal with healthcare, human life, biological systems, they're even more concerned about it. But you know, people were worried about the internet. Oh, it's going to be a bad thing. People were worried about the Encyclopedia Britannica when it first came out. The knowledge therein might not be good enough, might not be comprehensive. So of course, we're worried about augmented intelligence as well. My role will be briefly to show what we probably cannot talk about this morning, certainly not on the panel, because there's no time. But AI is already here. Anybody who doubts that Trust me, you are being helped with AI in so many different ways. Just some examples: diagnostics and clinical decision support. Examples would include precision diagnostics, imaging, mammography. Who's the real reader? Well, you get an AI reading and you also get a radiologist reading, but no one really wants to confess what goes on behind the scenes. Most radiologists would tell you that, trust the AI and then have a human being look at it as well. Clinical decision support, optimal treatment paths, tailored therapies already in use. Preventive care, algorithms that flag people at high risk and communities at high risk. Population health management, managing community health interventions. Disease registries for large populations are now requiring far less human input. And to an epidemiologist, a disease registry is the lingua franca of being able to understand the causes of disease and to launch appropriate therapies. Drug discovery and development, AI is there today big time, screening millions of chemical compounds quickly. Think about the Human Genome Project. That could have been done far more quickly today than it was a decade or two ago. Optimizing clinical trials, patient self-care, AI chat boxes and virtual nursing already happening. Reminders about doing the right thing in your home, not having to receive a call from someone. Behavioral reminders, wearables, medical devices, and other wearables. I'm excited, though, as well, and I think we will be talking this morning about operational efficiency, cost reduction, and I think that's a very fertile topic for the Council on Competitiveness, for business leaders, and frankly, for all Americans. We're shutting down the government over health care, but, there's enough waste and probably fraud today that if it could be weeded out and corrected, we would all be having better health care right away. Streamlining workflows in the back office, automated scheduling, billing, and documentation. Anybody here frustrated by the bills that come to you from your insurance company or Medicare for that matter after a visit? Better use of supply chains in healthcare, the availability of beds, the triaging of the ICU or the CCU, fraud detection, and as I said before, improved billing accuracy. But also equity and access to health care. Again, my core value being public health, using telehealth, including language translation and the removal of other barriers. AI is doing that today. Reducing health disparities by helping standardize care decisions. And then the use of big data, of course, and analytics to help clinicians provide even more empathetic judgments and moral reasoning. Deborah and I were talking the other day. We're a little worried about AI being unleashed without the human touch, without the philosophical or ethical imperative. We're not going to let that happen, but we do need better governance of AI. In closing, I want to talk about medical education, the use of AI. Today, medical students are being helped. Of course, we've had patient simulators for a long time. You could call that AI, even though they've been around for a couple of decades already. But ways, in fact, that you could better read pathology slides, AI to facilitate medical student team interaction. But as I said before, and I'll close with this, what we do not yet have in healthcare is a mediated governance plan for the use of augmented intelligence. And I hope we could discuss that and some more of these issues as we continue with the panel.
Thank you, Harris. And I want to come back in a little bit to ask you how things are going in the American Medical Association, because you've played such a strong leadership role there. Joan, here, of course, we are in Pittsburgh. We've been talking yesterday and today about this incredible transformation, the heart of our industrial revolution. Share with us what's going on in Pittsburgh in the health arena and, of course, the leadership of University of Pittsburgh and your many partnerships.
Yes, thank you, Deborah. So I can answer that question, but it's very important to say that the reason why we haven't answered that question is because one of the cultures of this region and this city in particular is one of collaboration, as Farnham described in his opening remarks. So people refer to this community's renaissance around EDS and MEDS, or as Farnham said, EDS and MEDS and emerging technologies, which I like and intend to shamelessly steal, with attribution, of course. But the idea of the role of really vibrant, very active research universities in the regional economy has led to very robust streams of activity, and particularly most recently we've seen a lot of emergence in life sciences. But for those of us who do life sciences work or are adjacent to our life scientists, clinicians, and otherwise know that it takes, a generation to be an overnight sensation in this space, that it's a long game to be innovative. And so the university's role individually and collaboratively in reinventing what the Steel City into the city that it is today, I think is the key thing to have in mind as you think about what's going on in Pittsburgh. So the two universities together contribute $10 billion to the local economy, and with that comes sort of the obvious jobs and revenue and students and that sort of thing. But a very big part of this is because of the research funding that comes into both institutions and the activity associated with that into translation into robust employers, of course, but also into clinical care and treatments, with two of the largest health systems coming out of Pittsburgh and then in service to wide regions of the country with UPMC and Highmark. And so the nature of what's happening here feels very energized, very positioned to cope with the headwinds as they come, and also anchored because it was born out of very challenging headwinds and leans into a culture that we didn't have to create, but as relatively recent arrivals have benefited from. So I would say what's going on here is what Farnham said it was, EDS, MEDS, and emerging technology. And a lot of that emergence is in life and health sciences in ways that we're really looking forward to diving into in more detail over the course of the day.
Thank you, Joan. Well, Farnham, let's build on your opening remarks as well and talk about, Carnegie Mellon's tremendous leadership role in, of course, the digital world, but I'm thinking of your global position in robotics. So I'm going to be provocative, and before we get off the stage, you have to tell us, are we going to expect robots to take care of us when we're old?
Oh, there already are, so that's an easy answer to that question. It's too late. But, candidly, my colleagues have alluded to this, that we need to recognize that the revolution that we're experiencing and the impact of these emerging technologies and AI, including robotics, without any doubt, is one of the most transformative intellectual developments of our time. And the impact of that on every sector of our economy is undeniable. We see this in finance, manufacturing, certainly in education, and absolutely in healthcare. What's quite exciting about healthcare, as it was alluded to, is that we're right at the cusp of transforming healthcare in ways that we could not have even imagined it 10 or 15 years ago. And this is happening in a lot of different ways. It's happening in drug discovery, it's happening in diagnosis, it's happening in smart hospitals and AI-driven care. It's happening in precision medicine and personalized medicine, in connected health. Earlier, it was mentioned public health and the implications of that as we have come out of a pandemic. Imagine if we're able to bring all of that data and technology to bear in enhancing public health and global health security. There are also technologies that are being developed, for example, in bioelectric therapeutic implants, or in ways that we're using data to enhance well-being, both cognitively and physically. So the sky is the limit. But one issue that was raised that I want to underscore is that we're just scratching the surface. We talk about all the cool technologies and research that's going to enhance our quality of life. It's going to transform healthcare. But we shouldn't also forget that healthcare is fundamentally a business. And in some ways, the impact of these emerging technologies in delivering a much more efficient healthcare to population is probably something that we're underestimating. Of course, there's going to be a transformation of labor, and we need to be cognizant of it. It's happening in every sector of our economy. Some new jobs are going to be created, some jobs are going to be lost, and many jobs are going to be transformed. So in fact, one of the challenges for higher ed and the private sector is how do we meet the moment? And how do we embrace essentially this point in human history such that we can transition, regardless of the sector of the economy, to take advantage of these technologies?
Thank you. Jeff, you are, of course, leading the University of Nebraska system, but also prior to that, the whole medical system of the state with its clinics and hospitals and research and medical school, but you're also a physician and a surgeon. So share your perspective really as both a leader of a big institution at the fulcrum of this, but also a doctor.
Well, thanks, and it's an honor to be here. And by the way, for those of you who are not aware, Nebraska is a state in the middle of the country here. The only triple landlocked state, yes. You know, I've given this an awful lot of thought. My actually undergraduate background is in engineering and in theoretical mechanics, which it turns out to have come full circle through my career as a cardiac surgeon and then in university leadership. Healthcare has been very rapidly evolving over the last decades. Every year, you know, the amount of information, publication, discovery, etc., exceeds everything that has been ever published or written or discovered in the past. It's moving that fast. And we know that from data storage, we know that from changes in treatment, diagnostics, etc. And AI, and I love the use of augmented intelligence because you're absolutely right, there's nothing artificial about it, and it's been around for decades, just continues to evolve and has been critical to the delivery of healthcare. But it will do a number of things, including accelerate the research, science, discovery, and application of what goes on in our great university systems and in the private industry. It will reduce cost without a doubt because it will remove inefficiencies, duplication, etc. It will enhance safety and quality in healthcare. It will accelerate early diagnosis, which is really the name of the game in all of healthcare, because as we all know, the earlier you can make a diagnosis, even before somebody is symptomatic or has an abnormal scan or has an abnormal blood test, that is really the time that you want to intervene. I mean, just to give you an example, we just applied a novel type of CAR-T therapy to the treatment of multiple sclerosis. It was a single-dose therapy. It was actually genetically created through the use of artificial intelligence, used in, I can say this publicly, in a 41-year-old lady who was essentially wheelchair-bound, mom of 3, who is now extremely mobile after a single-dose therapy. You know, one treat is not a forest make, but it gives you an idea of the power of this. And also, very importantly to all of us, it will democratize the access to quality health care. It will make the rural-urban divide far less prominent. It will change the way individuals can access care through mobile devices and mobile technology. And it'll do it in a way that no one's going to ask where they grew up, what their beliefs are, what their preferences are, etc. So for all of those reasons, not to mention the fact that from an economic development perspective, it is a gigantic and rapidly evolving industry, and it is going to be critically important in the economic race that our country has going forward compared to other parts of the world. And so we need to, in our educational institutions, which we are very proud to be doing as well, and I don't just mean in engineering and information science and technology, but I mean applications into agriculture, into healthcare, into energy, into national defense, etc., have to be front and forward for all of us to win this race, lest we have to be dependent on other parts of the world. So very exciting time and important to grasp hold of this at this moment.
Thank you, Jeff. And it's important you raised agriculture. And of course, Nebraska's role in the food production system is huge here in the U.S. and globally. And there's a connection as well with health. So we'll come back to that. Admiral Carter, you're really bringing tremendous experience from having been, a very senior leader in the U.S. Navy, the Naval Academy, then in Nebraska, now in my home state of Ohio with a great medical school, but also an institution that has been a very important leader, as has Pitt and Carnegie Mellon, in our leadership in supercomputing, the Ohio Supercomputing Center, and now AI. So you're bringing a wealth of background to this issue of bringing together the health and the AI systems and what that means for our competitiveness future.
Deborah, good morning, and good morning to all of you. It's great to be on this panel with all these wonderful experts up here. I don't normally get in front of a large crowd and get introduced as Admiral. People have forgotten that I did that for a few years. And, as I think about what Harry was talking about when we opened up and what you mentioned, Deborah, about the extension of life, our health system has been doing amazing work for decades already, before we've even gotten to start to integrate these principles of artificial intelligence or augmented intelligence. I flew in fighter jets for most of my career, and I was able to still fly operationally as a 53-year-old two-star admiral on board the USS Enterprise just 13 years ago. That would be unheard of 40 years ago, and that's a credit to medicine that was in our military and allowed me to do that. So I'm an abuser of the health system because I got to use that and see that in my operational career. As I've now been finishing up my second year as being president at The Ohio State University, the one thing that we have as the state's flagship, and we're a land-grant institution, is we have size, scale, and scope. And it gives us that opportunity to really lean forward and do some things that I like to refer to playing on offense, when unfortunately many of our higher education systems are playing a lot of defense these days. We just started off our 10-year strategic plan called Education for Citizenship, and the topic that we're talking about today is right in the center. The state of Ohio is a very complicated state, 7 metropolitan cities, 88 counties, 32 of which are extremely rural, or what we call Appalachian, and yet we are 41st in the country for healthcare and health of our state, which is not in the good number. That's 41st worst. So we have a responsibility to make sure that we're taking care of the health of our entire state. We have a medical center that is as large and does as much revenue for the university as our academic and research arm combined. We are erecting an operational medical tower this year. It'll be the largest freestanding hospital tower erected in the United States in this next year. In fact, when we put it in operation, 820 new beds. We add 150 of that to our cancer center. We'll have the second largest cancer center in the United States. But those are just the numbers. As I think about some of our big initiatives, we're taking a unique, bold approach to AI as a university system. We just declared an AI fluency initiative, which means every student in the state of Ohio that goes to Ohio State, all of them, regardless of their academic discipline, will be AI fluent by 2029. So that's starting with the incoming freshman class. And when you look at 15 of our colleges, our health colleges, this plays right into this conversation. So it's really critically important. And to give you a sense of how comprehensive that is, we're talking about 67,000 students, 8,700 faculty, and over 22,000 staff will all be educated in the principles of AI, to include the healthcare side. And on top of that, we have a responsibility using the concept of an extension system, which is very agricultural based. It goes back to the Smith-Lever Act of 1914 that allowed us to put, research in all of our counties. we're now applying that to take our health care into those extension offices so that we can take care of those regional as well as those Appalachian counties. We're really just on the front cutting edge of this, and there's a lot of work to be done. We've created a new AI hub, or AI to the power of X, which will be part of our research arm to get into this. And I know we're going to talk a little bit more about how this is all intersecting. But this is a critical moment where this is a little bit more than just ChatGPT. And a lot of people think that that's what AI is really all about. This is really about not just creating efficiencies, but creating the speed to solutions that will change basically how we live and how we think for the rest of our generations. As we talk about the encyclopedias and then the advent of the internet, AI will take us to all of those levels at least 10x. And we don't really even know how far this is coming, even though it's here now. So this is an exciting time. Institutions like Ohio State that have size, scale, and scope, we're really leaning forward.
Thank you, and we'll come back to talk a little bit about, how you're building this in to the healthcare systems of private insurers and employers as well. But that brings me, Chad, to you representing business on our discussion. As CEO and chairman of DuPont, you were overseeing a very expensive healthcare system for your employees, and then serving on many corporate boards, including the Healthcare Corporation of America. And so share with us, from your perspective, seeing the evolution of healthcare as a user, provider, business leader, but how you think it's going to be impacted by the AI revolution.
Thanks, Deborah. This is an honor to be here with this panel. Let me reference time. For 4 years, I chaired the National Academy of Engineering, and one of my board members at the National Academy of Engineering was also a member of the National Academy of Medicine. So at every board meeting, he would tell me how important it was for engineering and medicine to work together, not just by luck, but by an organized way, and what a difference it could make. And it really struck me. So let me just share one example that I've seen of that happening. It's Dr. Ken Panetta at Hopkins here in the U.S. saw some scientific work being done in Switzerland that had nothing to do with human health whatsoever, but knew his work. He's also a surgeon at Hopkins, still is today. Said, I think I can take that scientific breakthrough and predict or analyze for prostate cancer, but in a much more usable form than it's done today, because I'll take a snap of your hair. You can mail that sample in for less than $50. You could actually determine whether you have prostate cancer or not. So much more likely that people will do that and do it frequently enough so you can have early detection. That was 4 years ago. He saw that article and made that discovery. Today, 94% accuracy in predicting prostate cancer in men from that work. It's not commercial today, but that's thousands of tests. Everything is looking extremely good. The next question you asked was, what else might it apply to rather than prostate cancer? And yes, the next one they went to was breast cancer, and equally outstanding results. Not quite as much data, but outstanding results. So that happened because you put these two disciplines together. And just think if we did that in a more orderly way. By the way, the most frequently asked question about this hair sample, you might think about it in a minute, is does it work on colored hair? And yes, it does work on colored hair. So everybody could be very relieved. A lot of people that would use this test might have colored hair.
I'm not worried about that.
I am.
What if you don't have any hair? That's a huge disadvantage.
That's great. Thank you. We're going to turn to the whole issue about people. Yesterday we had a long discussion about making sure we never forget that people at the heart of everything, and we talk a lot about technology and engineering, but it's all about us as human beings from the time we are having children all the way through longevity. We're going to hear about longevity later in our program from one of the world's leaders, Dr. Khan, who's with us. But back to people. Do you think that the generation of students and graduate students are really seizing this moment? And Joan, you have an incredible reach with the medical system here in Pittsburgh, the largest employer, and of course with Carnegie Mellon. are young people seizing the moment to get into these research areas, and how do you see the training and education to fulfill this dream of this integration of AI and healthcare for competitiveness?
So we're in a very interesting transition. So at the undergraduate level, yes, ChatGPT came into their lives when they were still able to speak it without an accent, so to speak. So they're going to be virtually native, and then as younger generations come up, K through 12, assuming we demonstrate the intentionality that we're absolutely committed to make sure that the K through 12 system is a partner to us in higher education, I think we can fully expect that from an undergraduate level, the way in which President Carter is describing the necessity of ensuring that everyone has fluency will sort of become automatic. And I think that's going to happen almost as quickly as our use of ChatGPT, even though that's obviously just scratching the surface. But in terms of embracing the leading edge and making sure that our universities, in partnership with industry, in partnership with our communities, in partnership with economic development and philanthropy, are preparing the thinkers to create the next chapters, I think that is absolutely happening, but we need to make sure that we're intentional about that too. That's not as organic as the use of AI is for youth or for certain industries that are naturally incentivized to adopt it. So we are thinking very carefully here, obviously, about our doctoral programs, but also about our clinicians and how we train and work with clinicians, and then how those two groups work together in their ecosystem to be innovative. So learning to care for people from who are sick, or from the public health point of view, learning to create wellness, or from the health span point of view together, learning to optimize wellness, whether it's because you're sick and want to be better or because you're well and want to stay well, will require support for that to migrate in a sector that's normally slow rapidly in order to ensure that we're doing our very best work there. So we're thinking about how we train clinicians, having a very large health sciences clinical training enterprise. We're thinking and working very closely with our health systems on the most optimized delivery of care. And then we're also looking at things like One Health and the idea of what public health means in order to power, using AI, our wellness before we ever get sick in the first place, and then live longer, live healthier, and look at it from that point of view.
All right.
I think one thing we need to consider is that on one hand, we need to teach AI, integrate AI deeply into our curriculum. And I don't mean just teaching AI to computer scientists. In fact, CMU launched the first ever undergraduate degree in AI in 2018, and that's been replicated in other institutions. But integrating AI into the curriculum, what I mean by that is that we see this in social sciences, we see it in humanities, we certainly see it in life sciences, that AI is now being deeply, deeply embedded into the curriculum through some of the experiments that we're all running. I know it's happening across all universities. But there's actually a more fundamental issue that I want to share with you. You know, for a long time, we've been talking about transformation of education. In fact, many of us on this stage can tell you that about every 10 years, there is a new gadget, there's a new technology that we say it's going to change and transform education. In fact, CMU has been on this journey of science of learning, which is understanding how people learn for a number of decades. In fact, if you're old as me, you know, a few decades ago, we thought if we gave a laptop to every kid, it would transform education. And then it was network connectivity, if everybody had internet connectivity. And about 10, 12 years ago, we talked about MOOCs. Well, it turns out delivery of bits and content is not the same thing as education. Education has to be much more personalized, much more adaptive. Of course, access is really important. But fundamentally, the question that we've been dealing with is, how does technology enhance learning outcomes? Not just delivering bits and contents. So my colleagues at CMU, we've been on this journey, as I mentioned, for several decades. We believe really we're at the cusp of change in pedagogy, augmented, of course, by advances that we make in our curriculum, such that we can make education not only much more accessible, we can make it much more adaptive, we can make it personalized, and demonstrate learning outcomes through this approach. And AI, and the current generation of AI, generative AI, is probably one of the first technologies that I've seen as a computer scientist that gives me hope that we can do this at scale. And here's what I mean by that. We have known this for decades, that if every kid, imagine in elementary school, in middle school, had his or her own tutor, their learning outcomes would improve by a couple of standard deviation almost immediately. We've just never been able to do that and show that using technology in a scalable, much more efficient way. I think we're finally at the cusp of our understanding learning science and bringing AI to bear, such that I predict within the next 10 years, we will see fundamental shift in how we teach, how we learn, and most importantly, improving learning outcomes for students in all ages, from elementary school through K through 12, and of course, higher ed. One more point that I want to make about education is how AI is going to transform scientific discovery process itself. So what we really need to consider is, can we bring AI into our laboratories such that we teach the next generation of scientists and engineers the discovery process that's really changing and shifting right in front of our eyes. And at CMU, we've been working on the notion of an automated science, which is not only automating the wet labs and discovery process, but also bringing machine learning and AI in accelerating discovery process. Again, our conjecture is that within the next few years, we're beginning to see signs of that transformation already, that we're going to train biologists, chemists, material scientists, and engineers very differently from the way we've taught them before. So there's some really exciting stuff just around the corner.
You know, I'm watching our time here, and we don't have a lot of time, and I might jump to a few other critical areas, and we can come back, of course, to what we were just discussing. But I want to ask both Harris and Jeff and Ted as well to talk a little bit about the impact of all of this on the communities. This is very important to the Council on Competitiveness. How do we really stimulate the inclusive prosperity of our communities? Is this convergence and adoption of AI to our healthcare system and discovery going to really improve the lives of average Americans who are trying to navigate a very costly system, access to doctors, all of that? I mean, it's not a good picture for many people in our country right now. Is this going to be an enabler, or is it going to be something that, again, will be more for the wealthy and the people that can access these capabilities? Harris, you want to start on that?
Well, it's up to us, Deborah, and I think the Council and the GFCC has a role to play. Of course, the word community is a big word. Are we talking about the business community, or are we talking about neighbors down the street? I think everyone. One little anecdote, years ago when Microsoft was negotiating with the nation of India to create, to be its internet provider, hardware, software, the leaders of India said, under one condition, we want you to make internet available to every Indian citizen. And Microsoft built kiosks in shops, in libraries, in gas stations, wherever they were, to make it more accessible. Now, was that the answer to everything? No, but Jeff mentioned democratization. And I will just say that if augmented intelligence remains only in the realm of the sophisticated, the college-educated, those with influence and affluence, it's not going to go well. And so, Deborah, I don't have the answer, but I believe that the Council has a role to play in this, and I think we need to start marshaling the things we do and begin speaking to diverse communities about their role. So it's a great question.
Jeff.
Well, certainly without the support of the community, small and large, this effort will be extremely hollow. And, coming back just to a minute from the educational side, while we need to be sure that we educate and train the next generation in how to use this technology effectively, it is just a tool that has to support the creativity of the next generation of workforce in this country. But it is not perfect. And so we also need to be very clear that there are limitations, there are ethical barriers, there are intrinsic biases based in machine learning and in artificial intelligence. And these are just opportunities to be sure that we build trust with the communities that we serve, because at the end of the day, if there's not a trusted relationship with the implementation of this tool, again, it will come off as extremely hollow.
I think we're just starting to get into the use of how AI can really change our access to supporting the community. I mean, I'll just give you a great example at Ohio State, just started in 2024. By the way, we've been using and integrating AI principles since 2018 with over 300 faculty and researchers at Ohio State. But now we're just starting to get into applications. We just initiated a use of a Microsoft application called DAX. And all it does basically is reduce the administrative load for clinicians, which has actually created over 12,500 additional free hours for our doctors and physicians to actually spend more time with their patients. It's had a huge impact just in that one tool in less than 1 year. And then the last point I just make is, as I talked about rural Ohio and those 32 counties, just this past year, using some of these principles, we've been able to increase 85,000 clinical hours to rural Ohio just by using some of these tools. And that's just using part of that extension office in all 30 or 88 counties. And that's just the beginning of that. So access to help our community, I think, is really critical in how we can use AI.
We have time, I think, for one more round of questions or topics. And I do want to, Chad, thinking of our dear colleague who's no longer with us, Koji Omi, the light and shadows of science and technology, former minister in Japan, I want to bring us to the critical issue of barriers, concerns, and cybersecurity. And both Carnegie Mellon and Ohio State, you're leaders in cybersecurity. What do you see as the opportunity and the challenge to ensure that the platforms and technological infrastructure for this revolution is going to be safe and secure and trustworthy? Who wants to start on that one?
I thought you directed it to
Directed
Chad.
to Chad.
Yeah.
You directed it to me, but changed the question. But that's okay.
Well, I referred to you for Koji Omi, Light and Shadows. So you can jump in.
So
and then,
I think the thing you're referring to, it was a great leader in Japan that really focused on, really cared about science, but had to look at the shadows, the things that could go wrong. And I'd like to go back to where we started off with augmented intelligence. I think that's so much better than artificial intelligence or machine learning or anything else I've heard. And I can't stress enough how early on getting the terminology right so people will think about how to use it is much different. As far as use and how it applies, I go to my friend Brian Moynihan, our former chair at Bank of America, and he was talking to the employees there who were all concerned about losing their jobs to AI. He said, if you become the best user of augmented intelligence, you got a job forever here.
Right.
It's those that ignore it and don't use it that will have the problem. And if we can get the whole society understanding that, I think it's the breakthrough.
anybody on this one?
I'll just add, I mean, this started for me, when I was at the U.S. Naval Academy, we created one of the first cyber operations courses for the country. And we learned so much in developing that. And now being at Ohio State, and as we're really delving into augmented intelligence, I do love that phrase, by the way, there are three critical pieces to this that we really have to be paying attention to. And some of this can be happening in our research, but also in how we apply it. And that is to make sure that, for as much good as this is doing, we have to understand how do we still be able to play defense here, because AI can be used for a lot of nefarious reasons, and that's where we can be vulnerable there. The second piece of it is to understand the ethical use, and that was referenced earlier. There's still a lot more work to be done there. I can just give you examples of being in a fighter jet where I had to make a life or death decision about releasing a weapon, And if I was on an automated system that was using AI, the weapon probably was been released. And I've had moments in my life where I didn't release a weapon for collateral damage and saving innocent civilian lives. The last point I'll make, and is one we haven't talked about yet, is really important, and everyone in this room is already feeling it. Our energy bills are going up. And why is that? Because when you use AI on a Google search, that's 25 times more energy than just a normal Google search. And if we don't start paying attention to that, we're going to run out of energy. So this is a really important part for research institutions like ourselves as we're thinking about this application. And again, we're just at the beginning of this. We better understand how to harness the power of AI and be smarter about the energy usage.
Thank you.
You know, I could maybe add one other point if I can.
And then
Oh,
you're
I'm
going
sorry.
to conclude, Jeff.
Okay.
All right?
Perfect.
Well, I think what we need to recognize is that... Is this on? Okay. Is that there are ethical, policy, privacy, and security implications of AI. And we're just scratching the surface. The pace, the scope, and of the discovery is so unprecedented, so fast, that I think government organizations, private sector, academia, we can't even catch our breath to be able to consider all of these things. And that's really a candid assessment of it. We've seen this in human history, that whenever there are new emerging technologies, we saw this during Industrial Revolution, that the policy implications and the ethical implications have to essentially catch up with it. But the pace of advances is so fast that I think the society faces a huge challenge. Let me just highlight a couple of things. The notion of misinformation and the use of AI for spreading essentially misinformation is undeniable. We can't explain the results of many of the generative AI results that we get. That has broad implications for trust and accuracy of the results that we get. There's obviously, as it was mentioned earlier, there are issues related to bias. There are also issues related to deep fake that we're seeing it in social media. So when you bring all of this out, there will be significant societal implications that we have to tackle, which means there's going to be a need for new frameworks, new governance models, not to prevent progress, not to prevent the advances that we see, because the advances are going to happen. But I think the implication of that also on the labor market has to be considered. So all of these things are issues that I know not only our academic institutions are tackling, but also the private sector and increasingly the government organizations are cognizant of. So we have a lot of work ahead of us.
Thank you. And the collective human wisdom that will guide us. Jeff, we're coming to Nebraska next year, so we'll continue this. What can we expect when we come to the University of Nebraska and have our conversation to carry this forward?
Well, this will be a very natural segue because we're going to be talking about the bioeconomy and how artificial intelligence, technology, and automation has radically changed the way we produce food for our nation and for a good part of the rest of the world. And as also a land-grant institution, we have an awful lot to share, and we look forward to seeing you all, and I believe it's the last week of April in Omaha. So until then, thanks for the day.
Thank you. Well, let me thank this fantastic panel for their insights, leadership, and the journeys begun here in Pittsburgh. Thank you.